How will you know when your dying person is getting close to the end of their life? Here are some things that you can look for that can happen in the last days to a couple of weeks before their death. At this stage, they're not really eating anything at all anymore, and they're taking very little liquids, if any. They've usually lost the ability to swallow. There may be changes to the hands and feet. They might be puffy or they might be cold and change color to appear to be more bluish or purple. They are probably going to be sleeping most of the time, and it will be very difficult to wake them up. And when they do wake up, they aren't going to stay awake for very long, and they might be a little bit confused or incoherent. Body temperature can change a lot. They might be very hot or they may be very cold, and they could also be really sweaty. This is when people may be having deathbed visions, seeing their deceased loved ones and pets, which they might tell you if they're able to speak or indicate that. And they may also be like reaching in the air and like picking at the air. Breathing changes are very common at this time, and also people may develop a lot of congestion, and that's that gurgling or rattling noise that we hear when they breathe. We're not always checking vital signs at this time, but if we are, the blood pressure is usually going down and the pulse rate is going up. If you have any questions, leave them in the comments section, and remember to like and follow if you want to know more about death and dying from a hospice nurse.